and East Copper Belt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society.
Welcome to The Lens. I am your host, Jacqueline Mola. As we continue to review the year 2024, we are delighted to host Mr. Anthony Mwansa, who is the coordinator for Zambia Agency for Persons with Disabilities here on the Copper Belt. Welcome.
Thank you.
Thank you. Happy New Year to you.
Happy New Year to you, and Happy New Year to our viewers. Thank you.
Yes. So just for starters, maybe I would want to find out from you what disability is.
Okay. Disability, as defined by law, is any impairment of body or mind or intellect which prevents a person from participating in society on an equal basis with others. In short, we're saying if there's something that is wrong with your body, or you're missing a body part, or one of your senses is not working properly, and you're unable to do what other people whose body functions are fully functional, then we define that as a disability.
Okay. So what is the mandate of the agency?
Okay. First of all, the agency is established by an act of parliament, namely the Persons with Disabilities Act number 6 of 2012. So everything that the agency does is actually drawn from that act of parliament. So the main mandate of the Zambia Agency for Persons with Disabilities is to promote the well-being and rights of persons with disabilities through coordination and regulation of inclusive disability services. That means we work with both state and non-state agencies or institutions to make sure that services that are being provided to persons with disabilities are fully inclusive, and make sure that persons with disabilities benefit at the same level as those without benefits, without disabilities. Okay.
Okay, so I know that, again, one of your mandates is to register persons with disabilities.
Yes.
How many have you registered on the Copper Belt, or how are you going about that?
Okay. This year we registered a total of, last count, 8,837 persons with disabilities here on the Copper Belt. And cumulatively, it means we now have on our database over 23,000 and close to 23,100 persons with disabilities who are registered within what is called the Disability Management Information Services. And these people all have certificate numbers, which they can then use to access services, in particular social protection services. Yes.
What is the process like, and how does one get registered, to be registered?
Okay. To be registered, one has to first of all get assessed by a medical officer from a government institution or a government health facility. So there is a specified form which someone needs to present themselves with at the health facility. And once they're assessed, so they then bring that form to Zambia Agency for Persons with Disabilities. So the registration is dependent on what the medical officer declares on that assessment form. So they do a full assessment of the physical state of that person, the mental, the intellectual, and then they also check the hearing and the sight, and then they give a full record and the declaration. Remember what I said about the definition of disability. They tell us if that person has an impairment in any of these, which is preventing them from functioning at the same level as those who do not have impairments. So it's not just a matter of Strictly speaking, it's not just a matter of someone having an impairment, but also if that impairment is preventing them from doing what other people can do. There are also degrees of disability. When they do the assessment at the hospital, they'll tell us what degree or what level, how severe that disability is. So it ranges from those who have mild, moderate, and then there are those who have severe and profound disabilities. So that's the full range, going from the least to the most severe type of disabilities that we have. Okay.
So once registered, what benefits do they enjoy, like the persons with disabilities? What benefits do they enjoy after being registered?
Okay. First of all, I must say registration is actually a requirement by law. Whether you want to or not, if you have a disability, from age 0 to whatever age you go up to, you need to be registered and be issued with a disability certificate. This is in the form of a card. So the main reason that we do the registration, first of all, is to help government to plan and program the provision of inclusive services to persons with disabilities. Okay, yeah. And then the secondly, these services that we're talking about, for a person with disability to access them, the disability card acts as a key, as an identification, because as you're aware, not everyone, there's not enough of the national cake to go around to everyone. So usually the most vulnerable in our society are those persons with disabilities. And even amongst those persons with disabilities, those who have a severe and profound degrees of disability are the ones who are least able to care and cater for themselves and provide for themselves. So that identity card then acts as a means to access mainly social protection services, which are provided under the Ministry of Community Development and Social Services, as well as other services. But then also on the other end, there are those people who need to access other services such as education and also employment. So government has put in place certain measures that promote or encourage people to employ persons with disabilities. And then also, when persons with disabilities are in employment, there are certain benefits which they get in terms of tax rebates. So that disability card then acts as a key to enable persons with disabilities or facilitate them to access those benefits from government and also from the private sector.
Okay, so I would want to know what those social services that persons with disabilities get to enjoy. What are they?
Okay. First of all, there's the famous social cash transfer.
Okay.
Yes, there's a social cash transfer. This is provided under, again, the Department of Social Welfare. There are also certain other social protection programs that are under Department of Community Development, such as Food Security Pack. There are women empowerment programs. Also, there are empowerment programs. Let me say this, in almost every program which government has put in place, in terms of empowering its citizens, there's a reserved portion which is there for persons with disabilities, including things like CDF, Citizens Economic Empowerment Commission loans, and all other services which are there. They're actually a reserved percentage, which is specifically just reserved for persons with disabilities. So even things like we're talking about NEMA now, yeah, there is an onboarding of people who are on social cash transfer and have the disability card to onboard them onto NEMA using that card. So in general, all services which are there in terms of helping or alleviating economic and other pressures on the persons with disabilities, the card acts as a key for persons to access those services.
Okay, so speaking of social cash transfer, I heard that they had revised the funds that the persons with disabilities are now getting. Can you talk a little bit about that?
I think Department of Social Welfare would be in a better position to comment on that. But in general, you are aware that government constantly reviews what's going on in the country, even the economic situation, and also the level of, because this is not supposed to be a permanent thing. Sometimes people's livelihoods improve, so we may need to remove some people from that program and add others. But then also there are things to do, like, for example, we had a drought. So government did put in place extra measures. Even during the COVID, there were extra measures, special social cash transfer programs, which were put in place to come in. But the social cash transfer over the years has improved, because what I know is initially it started off by as low as about 60 kwacha per month, given by monthly, which was 120, but it has gone up to about 800 to 1,200 kwacha, specifically for those with disabilities. Those without disabilities get half of whatever the persons with disabilities are getting. So that's another benefit of having access to the card and being identified as a person with disabilities.
Okay, I had an interview with one of your staffers.
Yes.
And I remember her mentioning something to do with when a person with disability is ordering something from outside the country, there are those taxes that are removed. If you may just highlight a bit about that.
I think that's specifically to do with motor vehicles. As you're aware, there are a lot of people with physical disabilities in particular face a lot of mobility challenges. So government has put in place, again, under the Persons with Disabilities Act, I believe it's Section 44, a means to allow persons with physical disabilities to bring in modified motor vehicles in the country duty-free. So they have to pay all the other costs, including the cost of the purchase and the shipment of the vehicle, but the duty on the vehicle is actually exempted for the vehicle if it's a modified vehicle, which allows, for example, a person who uses a wheelchair or has other physical limitations to drive that vehicle themselves, or there's another form of assistance which is there. So it is true that there's that exemption which is there. But then again, also assistive devices, things like wheelchair and crutches, are also exempt from paying taxes in general.
Okay. I heard you mention again issues to do with drought and how we've been negatively affected by the load management which has been put in place. How have you navigated through this as Zambia Agents for Persons with Disabilities?
Okay. Yes. As our part mainly is to coordinate what other government departments are doing in terms of alleviating. So through the registration and the identification of persons with disabilities in vulnerable situations, we've been able to work with the Department of Community Development and Department of Social Welfare to make sure that all the social protection programs that have come in to alleviate the impact of the drought are properly delivered to the rightful persons with disabilities in our communities. So we also, apart from registering individual persons with disabilities, the agency also has a mandate of registering organizations of and for persons with disabilities, in short called OPDs. So we're able to work with our OPDs as well to identify the most vulnerable people in our communities who are then subject to benefit from programs such as the drought, food security packs, which were being given. And then there was also an emergency social cash transfer, both again under the drought situation and then also under the COVID just a couple of years ago. So we're able to coordinate and also ensure that persons with disabilities, the right persons with disabilities, are actually benefiting from that. We're working again together with our OPGs.
Okay. I heard you earlier mention some of the incentives that government has put in place for persons with disabilities.
Yes.
Having those incentives put, how has it impacted most of your members?
Okay. I must say, in the recent years, even the coming in of the new Dawn government, a lot has gone into promote the well-being of persons with disabilities. For example, there has been a continuation of reserved employment for persons with disabilities, both under the Ministry of Education and the Ministry of Health. There has been a quota. There has been reserved 10% of all the positions that have been advertised or put out there to recruit citizens into the civil service have been reserved for persons with disabilities. In most cases, we're not even able to fill these positions. But for example, in the case of Ministry of Education, government then said, instead of, if you cannot fill that quota, for example, for the 30,000 teachers who are recruited, it meant we had to find 3,000 teachers with disabilities, which was not possible. Yeah, so they said, instead of that, we're going to make these positions available for those teachers without disabilities who have done special education, so that at least they're able to benefit learners with disabilities and bring development in that way. Then also, His Excellency President Hakainde Hichilema has made several appointments of persons with disabilities to, I think, almost all the commissions in the country have at least one person with disability sitting on those commissions. In particular, I believe the Emoluments Commission is actually chaired by a person with disability. But those are all measures that have actually benefited persons with disabilities. And then also, under CDF, like I said, they have reserved quotas for persons with disabilities. But then also under the bursaries, the secondary bursary, initially, this was only going towards learners who are in secondary school, boarding schools. Okay. But after interventions made by the agency and other stakeholders, government did recognize that for children or learners with disabilities, they actually start going into special schools, which are in most commonly boarding schools, from as early as early childhood education, grade 1 up to grade 7. So there was a circular which did come in to intervene and instructed all the local government agencies that do actually oversee the provision of CDF, that for persons with disabilities only, learners should also benefit from the bursary school from grade 1 up to grade 12. Yeah, so there are all these benefits which have come in for, and for persons who, first of all, must have that ID, because that's what identifies them as a person with disabilities. And supports their application when they're doing that, when they're trying to access these services. Even the HealthB, the Higher Education Loans and Scholarship Board, yes, they also give preferential treatment to those learners who have that disability card. Even when they're issuing that advert and requesting people to apply, they do make mention in all their applications, in all their advertisements, that a person must have the PID card and must attach it to their application so that they can benefit. So there have been quite a number of, I don't know whether you can call it achievements, yes, or things which government has listened in most cases, because the agency is also mandated to advise the minister or advise government, and government has given a listening ear to whatever the agency has advised. That's what I can say.
Okay. So what are some of the successes? I know you've mentioned some, but
Yes.
what have you picked from the year 2024?
And I think our core business as the agency, of course, is to register persons with disabilities. So when we say we've registered 8,837 persons during the period 2024, I think that's a major achievement for us, because we initially did have a target, or the office was given a target of 3,000 to try and register 3,000 people. So it's almost close to 3 times that target. And this was only achieved because our partners came in, like the UN joint agencies, came in and they did provide funding for us to actually go out in the field and conduct mobile registration this year. Yeah, so that has been a major achievement. Then also, again, under this government, the CDF Act has been revised to ensure that there's self-representation of persons with disabilities on all CDF committees. So again, we have come in and tried to coordinate and made sure, trying to make sure, it's an ongoing process to make sure that every constituency in the province has someone, an able person with a disability, who is sitting on those CDF committees to ensure the interests of persons with disabilities in their particular communities are well represented. And they have an equal share of the CDF when it comes in, whether it be CDF, the bursaries, or the project. And also just common projects which are taking place in the community to make sure that they're inclusive. If you're building a school, can you make sure that it's accessible both for persons with disabilities and for the children who don't have disabilities as well? So by having a person with disability sitting on the committee, we make sure that everything that is done is inclusive and persons with disabilities are not left behind.
Okay. So with all those incentives put forward by government, I know you're also working with, is it associations?
Yes.
Yes, called
Yes.
Chichetekelo.
Association Pope John Paul II.
Yes.
Yes.
How are you coordinating with such associations to make sure that even persons with disabilities are employed by people doing business from the private sector?
Yeah. First of all, again, these are provisions which are there in the Persons with Disabilities Act. It's not actually just supposed to be the public sector which is supposed to reserve persons with disabilities, provide reserved employment for persons with disabilities, but the private sector as well is supposed to do that. So we do engage several partners, like you say, Educare and the Association Pope John Paul II, to promote employment for persons with disabilities in the private sector. Most of it is taking place in raising awareness about this issue. As you may be aware, there are actually several incentives within the Act that do encourage persons with, or employers, even in the private sector, to employ persons with disabilities. For example, there's a tax rebate which you benefit. For each person with a disability that you employ, your company actually gets a tax rebate. Then for any adjustments that you make as well to the workplace, you can also claim a rebate. If, for example, the work situation is not conducive for persons with disabilities, but you say we want to employ a person or several persons with disabilities and we want to make adjustments to our infrastructure, you can actually claim a rebate on that from ZRIA on your thing. So the main work that we're doing is to raise awareness about this, because sometimes it's twofold. There is a stigma to thinking that persons with disabilities cannot perform in the workplace, okay? And then there's also just the fear and the lack of awareness that there are all these incentives as well that encourage employers to employ persons with disabilities. So the main work that we're doing in this area is actually sensitizing and raising awareness of that.
Okay. What word can you give to parents and caregivers who are hiding? Because there are some parents and caregivers who are hiding children with disabilities.
Okay. First of all, every child is a gift from God. And we must not, already it's difficult for the children when they go out there, that they're getting stigmatized and they're getting discriminated against. So if we start the discrimination and the stigma within our own homes, then what hope is there for that child outside? Okay. So we need to acknowledge, first of all, that no matter what disability the child has, it's a gift from God. And even if they are not able to perform what other children can do, they are supposed to bring us joy, or they will bring us joy in one way or the other. There are people who are out there who want to have children, and they are not able to have children. That same child that you're stigmatizing in your home, there are people who pray to have a child just like that. So let's start, first of all, by making sure that we take pride in that gift that we've been given. And then second, they're able, a disability can come at any time, okay? So even if you are given a child without a disability today, okay, are you going to say that when that child does acquire a disability later on, they are no longer going to be your child? So let's accept whatever form the child comes in, and also accept and be aware that any person can contribute to the family and contribute to the development of the country, regardless of whether they have a disability or not. So those are a very important question that you asked. And I think the encouragement is that let's take pride, let's thank God for the gifts that were given in form of children, and make sure that we contribute and give the necessary support, all the support that we have for them. Maybe that is the main reason that we were given, because God sees it fit that we are the ones who are capable to support that child and make sure that that child achieves. Otherwise, there are people who do not have children, and they pray even for that same child that you are stigmatizing against and hiding away in the home. Yeah.
Okay, government recently put some incentives on transport for persons with disabilities working in the public sector.
Yes.
What does that entail?
Okay. These are actually an additional amount on the transport allowance for people who have, in particular, again, I'll go back to the issue that we said about registration. You must have a card from Zapd, and it must identify the type of disability that you have and the degree of disability that you have. So this is to benefit mainly those who have visual impairments, who are blind, and usually trouble with an assistant, and those who use assistive devices such as crutches and wheelchairs. Those are the ones who benefit from this allowance, from this measure that has been put in place. For those who fall in between or do not fall within this category of employees, but still feel that they need to benefit, they need to approach the agency. And then after we make an assessment together with the medical facility, if we still feel that they are the one, they should benefit, although they have not been classified, we are actually empowered to write a recommendation letter and say this person does need this assistance in form of assistance. So that letter comes from Zapd. Okay. So, but initially, the main important thing is you need to register and get an ID. So the ID from Zapd, as you can see, is not just because even when we go out to register, there are some people who chase us away and say, no, I'm not poor, I don't want social cash transfer, so why? Yeah, it's affiliated to being poor. It's not something just for the poor. Like I said, it's like an NRC. You have to register. If you have a disability, you must get registered, because there are even these other benefits that are outside social protection programs that you can benefit from.
Okay. The same measures that government has put in place, is it only for people in the public sector, or is it also applying to those working from the private sector?
Okay, so this was actually negotiated by my understanding, it's something that's negotiated between the unions and the government, which is the employer. And from experience, we generally see that even in the private sector, they have unions, and these unions usually take the lead by what is happening in government. So the unions in the civil service have laid the gauntlet, and we hope that all the other unions will take a lead, as we are employing, and all the employers as well will take a lead from what government has done, because this is something that is honorable, and it's something that is, I think, in terms of social justice, because you can imagine someone who is blind, they're not traveling alone. They have to maybe have a guide with them, or if you have a wheelchair and you're using public transport, most of the time they'll ask you to pay even for that wheelchair. If you need, or you have to use alternative. You can't use a bus, you have to book a cab wherever you're going. So there's that extra cost that comes with having a disability. That is the common sense that has been used, or the rationale that has been used to actually come up with this new allowance. So we hope even in the private sector, they are observing and they're taking a lead as they are negotiating, and will benefit the same. We'll make sure that their employees will also benefit in a similar manner.
In a similar manner.
Yes.
With that said, what are your expectations for the year 2025, this year?
Okay. I think this year, like I said, there's a lot that government has pledged. Like we say, the CDF Act was revised to ensure self-representation of persons with disabilities. So first of all, we are going to make sure that this ongoing process will ensure that by the end of this year, every constituency in the province has someone with a disability representing their constituency.
Oh, yes.
That is the persons with disabilities on the CDF committees. Okay. Then also the CDF bursaries, we're also trying to make sure that the schools like the Dama, like Lions School for the Visually Impaired, like St. Joseph's, we had a lot of children who fell off or fell out of the system because they could not afford the boarding school fees which are provided. As you can see, in most cases, special education at that level is only provided by these boarding schools, usually missionary schools, yes. And we're hoping that they can more and more can take up this opportunity. More and more parents will take up this opportunity. So we're going full out. We've already started full out in raising awareness so that we get more children back. And even those that are in the system that are struggling, they also benefit because that money is there, it's reserved. Whether you take it up or not, it's been there, it's been allocated. Yeah. Then government has also shown a lot of goodwill in other areas. You may be aware that just in the last quarter of 2024, the president met representatives from OPDs from across the country at State House, and a lot of commitments were made, and including a circular number 30 of 2024 to do with accessibility of public places for persons with disabilities. So government has shown commitment that they're willing to promote inclusion of persons with disabilities. So our work is to make sure that all those commitments which government has shown, we are also delivered, starting, of course, with the ones that I've mentioned, and because circular number 30 has a sunset component to it, all public places are to make sure that they install or refurbish their infrastructure to make sure that they're accessible by 10th March this year. Yeah, so we have a lot of work to do in terms of our mandate to inspect, first of all, these public places and make sure that they, to inspect and take into account the level of accessibility, then also to come back by or before 10th March to make sure that they've put all the measures in place to make sure that the public places are accessible.
Yeah. Okay.
Because everything else that we're talking about, access to school, participating in the CDF committees, if the infrastructure is not accessible, then those people will not be able to access the school, will not be able to go and attend those CDF committee meetings because the infrastructure does not allow them to do that. So those are some of the measures. So 2025, mainly government has shown us commitment. So we're going to take up that opportunity that has been given to us, whilst there's still goodwill to make sure that everything that has been committed to is actually delivered before the year's end.
Your closing remarks as we come to the end.
I think I'll just pick up on that important question that you asked about children with disabilities and parents. Yeah. First of all, registration, I'll repeat that registration is for every person who has a disability, whether they are young, unlike the NRC where you have to get at 16. This one, as soon as you are able to identify that the person has a disability or an impairment, they need to get registered, because even the health care, if they need it, the education, everything will be at least be helped along because of that card. Then also parents of children with disabilities, again, that is a gift from God, and make sure that they're registered so that even when you say that you're having difficulties, government knows what, like I said, we maintain a register, and that information helps government to plan and program all these things that we are talking about, CDF, CEEC, all these social cash transfer. It's because government is able to have that information. So if you do not report and have that child registered, then government will not be able, or they will not be able to see the scale of the need that you have in our communities. And let us take pride in our children. If we're going to church, if we're going out, those are people that we need to take pride in, just like we take pride in all the other children that we have. Thank you very much.
Well, thank you, Mr. Mwansa.
You're welcome.
That has been very insightful.
Thank you very much, and thank you for the opportunity to talk to our viewers and with our people. Thank you.
Thank you so much. Well, caregivers, register any person that you are living with who has a disability with Zambia Agency for Persons with Disability. I have been your host, Jacqueline Mura. Thank you. Bye-bye and Happy New Year.
Danis Copper Belt. Danis Copper Belt. Danis Copper Belt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society.